Welcome to Daily Series, COVID-19 Special. 5 ways the coronavirus is changing everyday life. Using telemedicine and stocking up on supplies in light of COVID-19. Telemedicine and telecommuting were among the most popular responses during COVID-19 outbreak is affecting readers' day-to-day lives. Cases reported on every continent except Antarctica, from social distancing to self-quarantine. The steady rise in COVID-19 cases is dramatically changing day-to-day life across the globe. We spoke with healthcare professionals about the most common responses, best practices during the virus outbreak, and how people can manage their stress levels. 1. Using or intend to use telemedicine more. Telemedicine is important to take advantage of during this time. There are 3 reasons medical professionals should make use of virtual care: to minimize sick patients' contact with others, to give mildly ill patients who don't need hospitalization recommendations for symptomatic relief, and to enable people with chronic conditions to still have access to care. Telemedicine is also an approach to reduce person-to-person transmission of SARS-CoV-2 through reducing person-to-person direct contact. Telemedicine: there are reduced interactions between patients sitting out in waiting rooms and between patients and healthcare providers within the exam room. This could also potentially reduce the rate of transmission within the community. But this practice should be used only if patients have mild SARS-CoV-2 symptoms or are in need of non-SARS-CoV-2 related and non-emergent medical care, such as refills on daily prescriptions or to discuss lab tests. 2. Working from home more. Working from home may aid in reducing the rate of community transmission of SARS-CoV-2. If more people are at home, it reduces potential interactions with sick individuals. This is also why it is imperative for individuals who are sick to stay at home. We determine the contagiousness of a virus by the reproductive number known as R0, R0. This refers to how many people one single infected individual can transmit the virus to within the community. How quickly SARS-CoV-2 can spread in a community is between 2 to 4, meaning one sick individual can spread the virus to 2 to 4 other people. As a result of rapid spread, health systems can be overwhelmed with the volume of patients infected. When social distancing is practiced, including telecommuting, the rate of transmission will be reduced, allowing hospital systems to better handle the pandemic and flatten the curve. 3. Stocking up on medications and OTC medicines. It's essential for individuals to have their normal daily medical supplies available at home, particularly their medications. This is important in case they develop symptoms and need to be quarantined at home for 14 days. For people with chronic conditions, it's very important to make sure they get a minimum of a 3-month supply of prescription medications. Keeping chronic conditions under control is very important, because people with them are at the highest risk for the COVID-19 disease. Keeping open communication with your doctor, telemedicine, email and patient portals are all good options during this time when we are practicing social distance. 4. Buying medical supplies I wouldn't normally purchase. People are buying medical supplies that they normally wouldn't purchase. The 2 most popular? Thermometers and face masks. Face masks play a role for individuals who are infected who need to seek medical assistance and for caregivers of people who have become infected so they can protect themselves. It is not currently recommended for non-infected persons to wear a mask. Preserving access to masks for those who need them the most is critical for their health. For people with chronic conditions, recommended having a blood pressure cuff at home, ideally one with Bluetooth so you can upload the information easily to your doctor. Inexpensive blood pressure cuffs work fine, too. People with lung conditions may want to consider home digital stethoscopes, that can listen to the heart and lungs and send information to your doctor, an at-home medical exam kit that works in tandem with a healthcare provider. 5. Practicing more social distancing. There are many things we can do to help protect ourselves against this novel coronavirus: avoiding contact with sick individuals, and to stay 6 feet away from somebody who's coughing or might be sick. Don't feel shy on public transportation, for example, about moving away from somebody who's coughing, not going to work if you're sick. Stay home until at least 24 hours after a fever. For elderly individuals, avoid unnecessary visits and interactions. Thank you for watching. See you tomorrow.